So welcome everybody. I'm Dr. Howard Koh, and it's my great pleasure to moderate this very important studio event entitled Pandemics and Disasters, Lessons for the Future. And we're so honored to have as our discussant, the immediate past Assistant Secretary for Preparedness and Response in the Biden administration, the ASPR. Dawn O'Connell is here, and she is a remarkable public servant, as you'll see, and has spent her career in public health domestically and globally, and then as the ASPR, the lead health emergency preparedness and response official in the United States. I had the pleasure of working with Dawn in the Obama administration, so it's great to be reunited with you again, Dawn. And Madam Assistant Secretary, welcome. Big round of applause for Dawn O'Connell. So Dawn, as the ASPR, you started your job at the peak of COVID, worked through Delta and Omicron, faced other infectious disease threats like Mpox, and then all the while you were facing other challenges like wildfires and floods and hurricanes and even some cybersecurity threats. I mean, this incredible portfolio. So tell us from a very high level what ASPR is all about, how your agency fit into the emergency response system across HHS, across government, and across the country.
Well, Howard, first let me thank you so much for having me. It's delightful to be here, for our time working together and to be able to experience the current atmosphere that we're in. I'm, just delighted to have this conversation with you as I reflect on my tenure. So pleased to be here with all of you as well. I'm looking forward to the conversation and the opportunity to talk about these issues. So ASPR is the youngest of the public health agencies within the U.S. Department of Health and Human Services. It was founded after 2005, after the Katrina hurricane. The country realized at the time that there needed to be a focus on providing health care in times of emergency. So through an authorizing bill called PAPA, ASPR was born. And ASPR's mission is to help the country prepare for, respond to, and recover from public health emergencies and disasters. So we have the advanced research and development of vaccines and therapeutics within our portfolio. We also have the National Disaster Medical System within our portfolio. So we provide the clinicians that will go out into a hurricane or a wildfire to provide support and clinical care. We have investments in domestic manufacturing to support vaccines and therapeutics. We have the Strategic National Stockpile to stockpile the medical countermeasures that will be needed in a public health emergency or disaster. So we're a pretty wide-ranging organization. We're younger than CDC, NIH, and FDA, but we sit right with them when it comes to responding to these important emergencies and outbreaks.
What a portfolio. So we could spend hours on each part of what you just said, but let's talk a little bit more about vaccine development. You know, and we know that we're in a time of increasing vaccine hesitancy and even resistance. I think part of that issue is that most people don't get to see what you see every day, the rigor and the effort that goes into proposing vaccine candidates, putting it all through the system, getting it FDA approved, and then out to the public into people's arms. So comment a little bit about that process from beginning to end and your views on that as the ASPR.
Absolutely. So vaccines are a critical tool that we have deployed successfully across many infectious disease outbreaks. BARDA, the Biomedical Advanced Research Development Authority within ASPR, has responsibility for the advanced research and development of vaccines. So that's the part that we're responsible for in ASPR. NIH does early bench work up to phase 1. Biotech companies do that as well. But the role that BARDA plays is it takes those phase 1 trials, moves them into phase 2, phase 3, and into FDA approval. BARDA has approved 96 vaccines and therapies in the course of its existence since 2005. So it makes sure that it works through that very rigorous process, Howard, that you mentioned, to ensure that it abides by the safety and efficacy that FDA puts out. We really rely on the biotech companies and the early researchers to have the proof of concept, and then BARDA takes them and turns them into the vaccines, the therapeutic, the diagnostic that many folks became very familiar with during COVID and we've deployed in other outbreaks.
That's great. Can you say even more about how ASPR and CDC and NIH all work together on issues like vaccine safety? I remember when I was there were 6 or 7 advisory committees with very high-ranking scientific experts looking very closely at all this data. The safety issues were so important before anything got released to the public. Do you want to say more about all that?
Absolutely. So we worked very closely with FDA, which are the regulators, to make sure that they had the data that they needed in order to make an informed decision about the safety and efficacy of any of the vaccines. So that was step one. And then FDA would bring that information to its advisory committees to make sure that what it was seeing was validated. CDC has the ACIP, which is the Advisory Committee on Immunizations, and they then, whereas FDA's responsibility is to do the regulation, to do the licensure or pre-licensure of the vaccine, CDC makes a recommendation about how that vaccine will be used, which population it will be used in, what makes the most sense when it comes to the safety and efficacy of the deployment of the vaccine. So we have a check and balance within the federal government. ASPR, BARDA, if it's one of our vaccines, will work very carefully with the data to ensure that we've got a good product to then bring to the regulators, FDA, and then FDA will make their decisions and then bring those to the recommenders, which are CDC. So there's a series of ways in which we are in constant communication to ensure that what each part of that very rigorous process has evaluated holds up in the next step.
That's fascinating. And then yet another part of your responsibilities was hospital preparedness. And we all know that hospitals have a tough job these days. They're trying their best on a day-to-day basis to take care of patients. But then when crises come, they have to demonstrate so-called surge capacity. They got to ramp up capacity to take care of hundreds or even thousands more patients. You help coordinate that across the country. Tell us more about that.
So ASPR runs the Hospital Preparedness Program, which administers grants to hospital systems and coalitions across the country and in the territories. We administered $240 million worth of grants last year. And what we do is require that the programs, the hospitals that receive these grants, actually are moving forward in their preparedness efforts. We saw how important that was during the surge needs during COVID to make sure that they had staffing plans in place to bring in the clinicians that are needed. And if they didn't, that they had the next way within their communities to be able to load balance. So one emergency department, and the reason why we have these coalitions in the Hospital Preparedness Program, is one emergency department in one city might be overrun. They would then be able to move patients and recommend patients move to the next one in the coalition. So they're load balanced across the region that's impacted. The Hospital Preparedness Program supports that sort of load balancing and making those decisions. But we also, as the sole source of federal funding for hospitals to be prepared, we look across the horizon to understand what threats are coming. It's one thing for hospitals to be prepared for what we saw in COVID in 2020 and 2021, them being overrun by patients. We're also seeing cybersecurity as a major issue that's threatening hospital providers and healthcare systems. So in the most recent version of the grants that we've administered, we've encouraged hospitals, in order to be in compliance with their grant, to take certain steps to prepare themselves against cyber attacks. And we'll continue to use the Hospital Preparedness Program as a way to leverage what we need hospitals to be prepared for against an ever-changing threat landscape.
That's amazing. And then, because you didn't have enough to do, here are these natural disasters. You were very involved in the 2020 fires in Maui. And then in your last days in office, the LA fires broke out, leaving thousands of people without homes. Tell us more about your role and ASPR's role in all that.
Absolutely. So a lot of people ask us what's the difference between ASPR and CDC, and we work hand in glove in a lot of the things that we do. But the way I'd like to describe it to folks is ASPR provides the tools that are needed to do these responses. So we talked about vaccine development and the role that we play in developing vaccines and in stockpiling those vaccines. We also provide the clinicians that go into the disasters, and we work very closely with FEMA in that work. So hurricanes, wildfires, if a hospital system is overrun, is taken offline, is unable to manage the critical care that's needed to respond to the disaster, we will deploy our teams into that. We also have, and those are the disaster medical assistance teams, the DMATs. But we also have another set of teams, and these are the only fatality management teams within the federal government on the civilian side. DoD does their fatality management work, and it's the disaster mortuary teams that live within ASPR that do the civilian mortuary work. So when the wildfire in Maui occurred, we deployed over 150 responders to support the coroner's office in Maui. And you can imagine that was extraordinary work that our teams had to do. We had forensic anthropologists, we had dentists that were working to sift through the ashes, the remains of the loved ones, and reunite the loved ones with their families. And the work that they did and the way that they did it was one of the most impressive things that I got to witness in running the organization. With the wildfires in LA, it was extraordinarily more resourced. We didn't need to go in to support the medical support, the clinical care, but we will and always are responsible for recovery efforts and behavioral health needs. And so we'll be doing that work. I mean, of course, I'm no longer there. The teams that are left behind will be supporting how they can. The state always has to invite us in. So I think that's one of the critical things people don't always understand, is that we're invited in by the governors and by the local communities. So should that happen in California, I know the ASPR team will be ready to go in and support recovery.
Amazing, yeah. So Don, when you reflect back on the last 4 years plus, many lessons learned, and then here we are, as we speak, the flu is at its highest peak in 15 years. Everyone's watching carefully the bird flu, H5N1, which has led to transmission from animals to humans for close to 70 people. What should we be thinking about now in terms of what we've learned, and especially recently, that's going to help us as we look forward?
Well, there's very little that you can say that was good that came out of COVID, very little, except one of the things that the ASPR team has been able to reflect on is it identified some of the gaps, and it allowed us to fill some of those gaps with COVID supplemental dollars to give us capabilities that we've always needed but never been able to afford as a country, and to be able to use them and demonstrate their value in COVID and then apply them moving forward. I think we understand coming out of COVID that we'll always have the need for an infectious disease responsive vaccine, a therapeutic, a diagnostic. So having those systems running, the development that we talked about earlier, Howard, knowing that those processes are in place to bring a vaccine forward very quickly is going to be very important. And one of the lessons we learned through Operation Warp Speed across both administrations was how quickly we could develop a vaccine from nothing in 11 months, which was remarkable. We want to do even faster, even better. There's the 100 Days mission right now. So that's one of the lessons. One of the things that ASPR really struggled with too was the supply chain resilience or lack of resilience that we experienced with PPE and other critical medical supplies. And we did several investments in domestic manufacturing along the way with COVID supplemental dollars to try to build infrastructure within the United States to be able to manufacture the things that we need moving forward. So we no longer have to wait for them to be in the ports of entry and then distributed from there, that we would have them already in country and able to be made available to our frontline responders. They'll have masks, gowns, gloves moving forward. So that was another thing we learned, was how important it was to have onshoring again of these critical medical supplies.
Incredible. The set of responsibilities you have is simply amazing. So we all know that as we speak, a new administration has just started, and the first few weeks have signaled much volatility and uncertainty for the future of public health. We all know that for public health in general to move forward, and for emergency preparedness in particular to move forward, we have to do this together as one nation and really promote continuity of operations as much as possible. Can you comment on all that? How do we keep this continuity going? Who do we work with to keep protecting people through future threats?
Well, you know, and I can't presuppose what this new administration will do. Like you all, I'm seeing what was reported in the papers and watching very carefully. The ASPR team is always in a crouched and ready position, always surveying the landscape, watching for what may be coming across the transom. Lots of focus on H5N1. So we made sure that we've got 10 million vaccines ready to go, that we've got investments in mRNA vaccines, that we have PPE in the stockpile that we're making available, Tamiflu in the stockpile that's being made available. But we're not just focused on H5, we're looking across the horizon, because often it's that thing that we're not expecting that comes and surprises us. So I give a lot of credit to the ASPR team for being prepared across administrations. One of the things that was so nice that I discovered during my tenure was that the work that ASPR does, it's a little bit below the radar. It's not as well known as CDC, FDA, NIH, sometimes to its advantage and sometimes to its disadvantage. But to its advantage is ASPR is often allowed just to do the work it needs to do on behalf of the American people, and they're not viewed through a partisan lens. Republicans have liked ASPR, Democrats have liked ASPR, and that has come in handy when we've needed to have these tools ready to go against whatever comes next. I was pleased for the 2026 budget markup, which again, we're in the continuing resolution and the budgets haven't been decided, but when the House marked up its budget, ASPR was the only organization within the Department of Health and Human Services to receive an increase. And this was a Republican Congress that was interested in not seeing government grow, valued the work that we were doing at ASPR enough to increase our budget. So I have hope that despite the change in administration and despite some of the headlines that we're seeing, that the work will continue. We've got a wonderful career staff that are there, that know the work, that are called to the mission, and that are ready to go should the country need it.
That's fantastic, Dawn. And we have chatted before about how we message our topics of public health and preparedness to all audiences. Do you want to say a little bit more about that in your role as the ASPR? How do we communicate the importance of preparedness to, and public health in general, to folks from both sides of the aisle?
Well, preparedness is expensive. That was one of the things I hit head on during my tenure, was I was asking for funds, for money to purchase things that we hoped we'd never have to need. And trying to explain that value proposition can be challenging, particularly when there are programs that have immediate needs that are very identifiable. But I think COVID taught us an extraordinary lesson, which is that preparedness pays off. That if we have the things that we need ready to go, we would have saved a significant amount of money in time in building our capabilities in early COVID. Throughout my tenure, I tried to hang on to those capabilities, even when it was unpopular. In 2022, we were encouraged not to use the word pandemic again, that people were tired of hearing pandemic, that we needed to talk about things in terms of biosecurity. What I know is that whether you're talking about pandemic preparedness, whether you're talking about biosecurity, the work is the same. We really are trying to protect the country from these emerging infectious diseases or intentional spillover of some of these diseases. So continuing to talk about that in words that are receptive to the audience that we're trying to influence, I think is important. And being flexible in those words is critical as long as the work stays the same and the mission is unchanged.
So every several years, there's more national conversation. Are we ready for the next threat? That comes up over and over again.
Yeah.
So as of right now, are we ready for the next threat? You want to comment on that?
Well, I think it depends on what the threat is. One of the things that I think about a lot is in 2018, you would have heard all of the experts, maybe even sitting up here, saying, gosh, the next thing that's happening is a flu, is a pandemic flu, because we were celebrating at that point, not celebrating, but maybe recognizing the 100th anniversary of the Spanish flu. And I think there was an awareness, and continues to be an awareness, that we're due for another flu, another highly virulent flu. So everyone was talking about that, thinking about that, rightfully so. And then coronavirus came across the transom in a way that no one was expecting. So I take that lesson very seriously. And in my tenure in this role, I wanted to diversify, to make sure that I was building platforms. Platforms that could be used not against one particular threat, but that could be used against all threats. That we had the resources we needed to treat the injury that was caused and not necessarily the cause of the injury. That way we could apply the tools that we were gathering for the American people to protect the American people against any number of threats, because it's so hard to predict. And when I looked across the threat landscape and asked again, are we focused on the right things, I will say the intelligence community was unable and unwilling to take any of the threats off the table. So it's hard to say what's coming next, and it's important for us to continue to be watchful and to have as many tools that work against any number of injuries as possible.
So Dawn, here you are, a person who has spent her life in crisis management on the domestic and global fronts. You've faced all these challenges day in and day out. You probably did not have a quiet day as ASPR, right, for the last 4 years. Tell us more about why you want to do this work. What motivates you every day to get up and keep going in this very, very exhausting work. You, and not just you, of course, but all the other colleagues in ASPR and HHS and FEMA and elsewhere who really have this tremendous commitment that you demonstrate.
Well, the mission is remarkable. You know, the call to be able to serve in this way, I think, is extraordinary, and the opportunity to live that mission is unique. And so if anyone in this room, anyone watching, gets an opportunity to participate in federal government, it's a remarkable experience. And the thing that makes it remarkable, even though this mission is so unique, and Howard, you and I shared this years ago, the people are even more extraordinary than the mission. The people that are drawn to this work are remarkable, and you really get an opportunity to work in rare air. So I always appreciated the support, the challenge that I had in working with some of the best and the brightest across the federal government. But the other thing, and I think one of the things that drew me in particular to this part of public health, not necessarily the longer term work that happens, but the immediate, is I knew day in and day out whether what I was doing was having an impact. It was measurable in the number of vaccines that we distributed, whether it was for COVID, for Mpox, whether the ones we're developing for H5. I mean, I can tell if I'm making a difference immediately. If we're saving lives coming out of a hurricane, if we're preventing cyber attacks, which will damage care. I mean, all of those things were extraordinarily measurable. Now, there wasn't much rest in 4 years. It was an extraordinary tenure to hold, but we had an administration that really believed in our mission, and that made all the difference. And I was surrounded by terrific colleagues who helped support the work that we were doing. And I could see day in and day out that we were actually having an impact, and that was really remarkable.
We have a lot of attention at our school about promoting future leaders. We have an audience here, mostly students who want to be future leaders like you. Dawn, what have you learned in your career that you could pass on to the students here about what leadership means in public health, especially in the emergency arena?
Well, leadership's critical. And so if you have an opportunity to participate in this way, I strongly encourage you to pursue it. Even if you don't know what the end goal is going to be of the decision to jump in and participate in federal life, do it anyway. The opportunity to work at that level, to impact the country as a whole, to work in communities is remarkable. But leadership isn't just part of the federal mission. I mean, leadership really separates people in this work. And what I've discovered, Howard, in my process and in leading this $3.6 billion organization that I had the honor to lead over 4 years is ruthless prioritization is required. And so many people in public health, and so many people, rightfully so, have various things that they want to pursue and follow and chase and look and do, and all of that is valid and worthwhile. But when you're a leader, your job is to decide what are the things that this group, this team needs to get done today, tomorrow, and in the next year. And you're prioritizing. You know that you can't do everything all at once. But in order to get as much of it done as possible, you're taking those steps forward, one foot in front of the other, every single day, bringing your teams forward. And before you know it, if you have prioritized well, you'll have made a huge impact. But I have found there's always this instinct, this desire to try to do it all at once, and you can't. You really have to choose the things to focus on that'll be the most impactful, and then build from there.
Incredible. And when we look at your career, Dawn, you've spent how many years in public service now? A couple decades, right? At least?
Yeah, I was going to say, I don't think I've added it all up yet, but I was 13 years on the House of Representatives, and then since 2011. So I don't do public math well, so others might be able to add all that up, but yeah, over 20 years.
And again, many of the students here and elsewhere want to give public service a try at some level. Do you want to just comment on that as your final set of words of wisdom for us?
Well, first of all, just looking out at the crowd, it's a terrific group here, and I really strongly encourage you all to think very carefully about public life in this way, and the opportunities that you'll have. So I've had the opportunity to do two different versions. I was in the House of Representatives as a staffer and had a chance to work for a wonderful person, Representative John Spratt, who recently passed away, and he was on the Budget Committee, so I had a chance to see what the House of Representatives does and how it approaches the work that it needs to do, particularly from a fiscal perspective. That gave me a ton of insight into what I then brought to the administration. So in 2011, I joined the Obama administration, and then, of course, Biden in 2021. And so I've had a front row seat to a lot of what's happened on the healthcare and public health space through this work. And the work in the legislative branch is extraordinarily fast-paced, particularly if you're on the House side. Someone's described it as you're in a little speedboat, and you can just move that speedboat as long as you're representing the district that your boss is there to represent. And then you work as part of a caucus, and you have particular interests, and you move policy forward in that way by moving legislation. When you get to the administration, you're actually running programs, spending money, making a difference, that those statutes that the House of Representatives and Senate have worked on, but you're actually getting to do the implementation. So if you're interested in the policy development, the strategic thinking, the making the statutes that then have to be implemented, there are two different branches that I've worked in. I enjoyed both of them quite a bit. I would say the administrative branch had a bit of a leg up. There's nothing like getting up in the morning knowing that you're impacting the vast majority of people, either through the programs you're running, the tools you're providing, or the money you're spending. And I think the ability to do that is a heady experience, and it's one that all of us, Howard, I know you feel the same way, we take extraordinarily seriously and felt really honored to be able to participate in. So I hope that you all get that opportunity and take it, and don't be scared. It's worth it, you can do it. The reason why you're studying these jobs that you're doing right now is because you're the next generation, and we really need the next generation to lead us. I have two kids, one that's 16, one 14, and I often say they're going to save us, this next generation. So we're counting on you all to see what's happening now, to understand the challenges that we face, to see how we chose to do it, and then to do it better than us.
So I think you have all heard from an extraordinary leader and public servant. I can't believe our time is up here, but a big round of applause for Dawn O'Connell. And Don, I just want to say thank you for your service. What an incredible role model you are for us and for our students and for the country. And you are our new Menschel Fellow. I should have mentioned that at the beginning. So you're going to be with us for not only this semester, but hopefully a long time after that to just keep sharing your wisdom with us. So we look forward to keep working with you, and thank you so much for being here.
It's my pleasure. Thank you so much, Howard.
Thanks.
It's terrific.
Thanks, my friend.
Thank you.
Thank you.